being able to do fillings here and there, and everyone's like, oh, I did a crown today. Oh my God, you did a crown? Oh my God, I can't wait until I get to do a crown. And it's just, that's definitely been a highlight. So yeah, dental school is an experience. It's fun.
Okay, so welcome, guys. We are here with a special guest. We've got Rachel Ogunleye, who's a dental student at Plymouth. I always get confused. Is it Plymouth or Peninsula? But I'm sure she'll
Yeah.
let us know.
Yeah.
Thank you for coming on, Rachel.
Thank you for, asking me to be here. It's a pleasure. So it should be fun.
Yes. So is it Peninsula or is it Plymouth?
To be fair, I think it's Peninsula Dental School.
Yes.
Under Plymouth University.
Okay.
So yeah, I'm not sure, where they stand in terms of being separate entities or the same thing, but we are with Plymouth University and we follow all the kind of rules that the Plymouth University vice chancellor establishes and things like that. So yeah.
Okay, no, that's cool. That's cool. I wanted to find out, so as we start, why is it that you chose to get into dentistry? Why dentistry out of all the things you could have done?
Yeah, so that question is quite an interesting one because initially I had not a clue about what dentistry was about and things like that. But so it wasn't until sixth form. So, it wasn't, I've wanted to be a dentist ever since I was like 5 years old and things like that. It was actually not until sixth form that I decided that, I'm actually very, very interested in dentistry. So at first I had like just a family member. She was a bit ill. I think she had shingles, and I was just very intrigued at the multifaceted kind of care and the fact that it was so multidisciplinary. They were, people that weren't only doctors, but I also saw kind of all surgeons or kind of dentists coming and help her. And I was very young at that time, but then I was so intrigued. I was like, a dentist in the hospital, at that point, it was like you only really see dentists when you're going for a checkup and things like that. So I wasn't really kind of open to that world of dentistry. I also don't have any dentists in my family and things like that. So I didn't really know, what dentists do. So yeah, initially I wanted to go into medicine actually, but then it wasn't until I started this widening participation program with King's College called K+. So it was for children that come from lower socioeconomic backgrounds and that attend state schools, things like that. And it was basically just a program for us to have exposure to the different kind of specialities within dentistry and things like that. So I signed up for it. At the time, I was signing up for like a load of like medicine related extracurricular activities. But then I saw this dentistry one pop into my emails and I was just like, okay, I don't know what this is about. So I clicked on that one and I applied. I managed to get in and it was an amazing experience. Like we found out about so many different things, even just things like dental history and, the materials they used to use in the past, all the way down to like dental public health and what that was about. So, there's not just dentists in hospitals or in like, primary care practices. You've also got dentists that, engage in public health. So it was a real eye-opener to me. And yeah, I think that's one of the main reasons why I chose dentistry as a career. Not only is it flexible, but it's just so multifaceted. There's just so many things to do,
Yeah. So the widening participation, do you know if that's still running with King's?
Yeah.
How do people find out about that?
Yeah, so I actually found out through a friend. At the time, it was open for everyone to apply to, as long as you went to a state school in London. And I think they have a whole list of schools that are eligible. And yeah, and they have different streams. So not just dentistry. It's actually an amazing scheme, and I really recommend it. So it wasn't just dentistry, but they also had maths, English, all sorts of streams, and you just picked the one you were interested in. And yeah, and then I picked dentistry, and yeah, and it's a long application form though, and it is a long process to get in. I think like every year like 1,000 students or something like that apply, but if you're interested, definitely type it in, you know, search it up. So K with the plus as in the symbol, or you know, PLUS, and it should come up. But it is a really good widening participation program, and it's open to, you know, any school and things like that, as long as it's a state school.
Outside of the widening participation, is there anything else that you would say was key in you getting into dental school?
Yeah, so as everybody knows, you know, work experience. So yeah, work experience is definitely key when it comes to applying to dental school, especially to the extent that, you know, I'm not sure, you know, but during my time,
Yeah.
it was a thing where it was a requirement. You had to have at least 10 days, I think it were. It might have changed now, so definitely check. But but yeah, it was definitely a requirement. And I know right now there's so many brilliant incentives right now. There's so many people that are doing it online and things like that. But it was a lot harder to get it when I was applying, and it probably still is. So I remember at that time, so I was calling around to every single practice in my local area, you know, in Enfield and Stoke Newington. I was calling and calling and calling, hey, you know, can I, you know, and yeah, but I managed to get 1 week in Enfield, and then to get the remaining 5 days was very difficult. So what I did actually is I called and asked if they need any extra help on the reception.
Yeah.
So I used to go in every day. Well, not every day. I think it was a couple of days a week after sixth form, and just go and help out on their reception, because I think some days in sixth form we had half days, so it worked very well. And so that was a good idea as well, because not only did it give me insight into, you know, what the dentists were doing in their rooms, but it also gave me a lot of insight into, you know, how busy a practice is, and you know, all the key positions everyone plays within a practice, you know.
What did they get
So,
you doing on the reception?
so I was answering calls. I had to answer some calls.
Yeah.
And I think with the receptionist thing, it worked very well, because I think with a lot of practices, they needed like a certain type of indemnity or insurance to have a student shadow them, or I don't know if it's changed now. So that's why the receptionist thing worked. But so yeah, so I was just kind of answering calls. I was alongside the main receptionist. So it was more so kind of like supporting her and shadowing her and just supporting her in her role.
Yeah.
And yeah, so, and just helping out with just whatever needed doing, you know, if it meant, you know, taking this to this surgery, or, you know, just helping support in the reception and manage some of the appointments, or
Yeah.
yeah. So yeah, making sure the patients were settled in the waiting room, because quite a few of them might be nervous in the waiting room. So it was quite interesting as well, seeing that dynamic, you know, what happens before the appointment.
And what did your family make of all of this? You going for the widening participation, going to work on reception, just trying to get into dental school. What did your family make of this?
Yeah, so I think they never stopped me. I mean, they were very they encouraged it, you know, whatever I wanted to do was encouraged, as long as it didn't involve like getting in trouble.
Yeah.
um and yeah, so like I said before, like not a lot of the dentists, I didn't have any dentists in my family and things like that. So at first my mom was quite intrigued, because my mom's in the same position as me. She didn't really know, like, okay, what's a dentist, you know, kind of thing. So she was like, you know, Rachel, why dentistry? Like, she didn't understand, why do you want to look in people's mouths? She was like, you know, why not be a midwife? You know, midwife, maybe that sounds good. You know, you could be a doctor. Why do you want to look in people's mouths? So it kind of took some persuasion and, you know, explaining to my mom, you know, why I like dentistry and things like that. But it's good though, because at the same time, everything I was learning from work experience in K plus and the widening participation programs, I could actually tell my family. It made it much easier to communicate actually why I like dentistry as well, which is another reason why I recommend, you know, the work experience. And you know, it makes it clear why it's so important, because it kind of helps you determine whether that's actually what you want to do, and
Yeah.
actually find out why you want to do it. So it made it easier to communicate to my mum, okay, look, I like dentistry because X, Y, and Z. It has these pros, and I feel like it suits me because of this. So yeah, so it made it easier to explain to them. I think they just wanted to be sure that I was really sure about what I wanted to do, and I was going into something that made me happy, which
Yeah.
is the most important thing.
And it looks like you've been getting quite involved, even as a dental student. So you've been doing the Q&As with dental specialists. Uh, you've also been writing articles. I saw the article you did, how the pandemic affected dental students. So yeah, just tell us a little bit about what you've been getting involved in. I guess if we start with the article you wrote on how COVID affected dental students, and
Yeah.
challenges that have been faced as a dental student.
Yeah, so with the article of Dentistry Online, that was quite interesting. So I was reached out to write an article. It was quite last minute as well, so I had to kind of like just write it, and but yeah, so it's always good. And I also did another one as well with Dr. Natalie Bradley, and that was for her tooth germ platform as well, just writing about the pandemic. And that was more kind of, so I guess the Dentistry Online one was more so with hindsight, whereas the tooth germ one that I did on the pandemic and how it's infected me was more so in the moment. So it was quite, interesting comparing the differences between, what it was like going through it and what it was like, after it. So upon reflection and how it's kind of changed things. And but yeah, so yeah, those were both very interesting experiences. I did them because why not use your skills to reflect, and if it can be out there and it can benefit somebody else, then just let it benefit somebody else. I think it's okay to kind of just let my 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 ability to actually be functional and to be of use and to serve somebody else. So yeah, so that's kind of why I just decided to say yes to doing these things and just seize the opportunity and just put it out there.
Yeah, tell us some of the challenges then that you've been experiencing in dental school, or your colleagues have been experiencing. What have you all been going through?
Yeah, so I think one of the kind of most poignant things is probably the gap in gaps that the 6-7 month break has probably left in our knowledge. And you know what, it's all well and good saying, yeah, there was uni online, but I feel like uni, staring at a screen in your room can only be so efficient and so helpful when it comes to actually letting things settle in your brain. And a lot of the time you're just looking at a screen and things like that. So I think that's one of the biggest difficulties. Kind of just having to look at a screen has been very mundane. It's been difficult, especially so with dentistry. Being in 4th year in Peninsula, we're actually in Truro, so it's kind of like it is a city but a very small one. So and we're quite isolated in that sense, so it's just us, and we all kind of live on site about 5 minutes from the hospital. But then I think the issue with having uni online is that you find that you don't leave the house a lot, you don't walk around, you don't have fresh air. So I think it's definitely had an impact on people's mental health and their physical health as well, just keeping them healthy away from the screen, walking around. So I feel like in that sense, we've all had to be a lot more intentional about our time, intentional about getting some fresh air, getting some sun, getting up between our breaks, whereas before it would kind of be implemented in our day, because I mean, you had to get up and go out to get to your lecture, but now you just put on your laptop and there you are. So just being I think we can probably all agree that we've had to be a lot more intentional about getting up, starting our day properly, putting on our laptops, going through our lectures, and then having a nice walk and things like that.
Yeah.
Obviously as well, in terms of clinics, a massive impact. So for the first month we didn't have clinic, and we didn't start that until late September. And then, as it were, there were a whole set of new rules to comply to when it comes to PP and things like that. And, the whole wipe down process and cross infection control. So it's definitely been very different and overwhelming. So, because you can imagine you've had this 6, 7 month break, then you're staring at the computer all the time. And then on top of that, you've got all this new information that's being hurled at you at like 1,000 miles per hour. So
Yeah.
I think if anything, more than anything, it's been an overwhelming experience.
Yeah.
But yeah, I think generally we're managing well, and we're kind of getting through the year. So yeah.
Yeah. What have been some things that you've been doing to try and manage through all of this? What's been helping you?
I think definitely something that's been helping me is being able to prioritize. Definitely, uni comes at the top of that list, making sure I get my BDS, I pass my
Yeah.
exams, you know, I write those assignments and things like that, but also finding time for myself, making sure that I am making time to eat, go out. And when I say go out, I mean enjoy the fresh air and things like that. Giving myself time to switch off from the internet as
Yeah.
well, because you can imagine our screen time is going to go up significantly, because now not only are we browsing Instagram and shopping online as we normally would, but also enduring hours of lectures online. So
Yeah.
just making sure that I'm actually allowing time in my day to like switch off my laptop and say, okay, enough screens for now. Now it's time to actually engage, face to face with, either my housemates in my bubble, or to actually go out, even if it means going to do some grocery shopping,
Yeah.
and and just enjoying the nature. So I think definitely that's something that's helped me massively, just being very regimented with like my downtime, and making sure that I'm being just as, kind of anal with my downtime and relaxing and things like that, and like going out and things like that, as I am being with revision. So I think it's an important skill actually, to just strike that balance of moderation in all things that you do. So yeah, moderation is good.
So, I mean, we've talked about the challenges there with dental school and all that's happening with COVID. Are there any highlights to dental school? Is there anything to be excited about with dental school? Just tell us about your 4 years at dental school. Has there been any highlights that you've experienced, just so that people get the other side as well?
Yeah. So I would say, that one of my like greatest highlights is definitely the people I've met along the way. Yeah, I've met some people, friends that they will definitely, I pray so, will be my friends for life. There's some really chill, cool people that I don't have to feel like the only thing I can talk to them about is dentistry. So like having even though they're also like dental students too, I can still relate to them on like a personable level. So yeah, definitely one of the biggest highlights, all our experiences. So Peninsula, shout out Peninsula once again. But yeah, we're right by the beach. So definitely, and me coming from London and then going to Plymouth, not something I probably would have done if it hadn't been for university. I mean, I don't have any family in the southwest of England. So, but that experience is such a beautiful city. It's so quaint. It's right by the beach. I can't stress it enough. It's just so peaceful. The air just smells clear. Like I miss it now as I'm speaking. But it's weird how over time, like, at first I was really apprehensive, like, I'm going to this far, far away land. But now I feel like Plymouth has become part of me a little bit. And definitely one of the highlights has definitely been my friends, has been the city that I actually study in, because it is genuinely a beautiful city. I think anyone that's been to Plymouth, that's been to Cornwall, can say that, yeah, it's a beautiful, very scenic part of England. And then on top of that, dentistry, of course, like, my patients. Peninsula is good in that sense, in that we start our patient contact in first year, in March of first year. And I still remember my first patient, and just all the clinical experience. I feel like I miss it now. I think, COVID has definitely been a shame, in the sense that, we've had to take longer holidays. We've seen, ultimately less patients because of the 6, 7 month break. But it is fun. I feel like every student, every dental student, the first thing they want to do is just start doing dentistry,
Yeah.
So the dentistry has definitely been a highlight, seeing patients, being able to do fillings here and there, and everyone's like, oh, I did a crown today. Oh my God, you did a crown? Oh my God, I can't wait until I get to do a crown. And it's just, that's definitely been a highlight. So yeah, dental school is an experience. It's fun. Like, it's actually quite fun.
We get a lot of aspiring dentists that watch the videos. Is there any advice that you'd give to aspiring dentists when you think about your application process for dental school and some things that did help you or may have helped you even further in getting into dental school? Is there any advice you'd give to aspiring dentists?
I would say, don't, just try your hardest. Obviously try not to stress, because stress can be very counterproductive. But make sure you're being organized in the way you revise, because at the end of the day, you need those A's, or I think it's like now you can have a B as well. So AA to like AAB. But try and make sure, don't lose sight of the goal. Make sure you are revising as much as you need to, alongside doing the extracurricular stuff, which are just as important for your application. Make sure you do get those grades at the end of the day. Stay optimistic, stay positive, and just keep on pushing as well. And I personally didn't take a gap year, but from a lot of my friends that have done that have taken a gap year, if you do need to take a gap year, I have heard that taking a gap year is an invaluable experience, and that it is very, very good. So I mean, I do know I have one student that I'm currently trying to assist through the process and things like that. So don't be afraid to message me. But also as well, so with her, she didn't exactly get predicted 3 A's from her teachers, even though she is quite strong in her subject. So I know that can be a barrier as well, actually getting your teacher to predict you the grades that you need to apply. But definitely I say in that case, just keep on studying, do try and get those A's, because even though somebody hasn't predicted you those A's, it doesn't mean that they have the final say. So just keep on aspiring and pushing towards those goals. And if you need to take the gap year, take the gap year. There's nothing wrong with it. Tons of people have taken gap years. Even in my dental school, there's a range of ages. I'm definitely one of the youngest, but I don't think I'm like, not everyone is like the same age as me, which is what I'm trying to say. So I think that's a lot of, something that I had a lot of apprehension towards. I was like, I really don't want to have to take a gap year, because then what if I'm older than everyone else? But actually, everyone forgets about how old everyone is. Like, it's not until their birthday that you're like, whoa, I did not know. But yeah, so as long as it doesn't show. But yeah, so just keep on pushing. Prepare where you need to prepare. So I know for the UCAT the deadline's passed now, but a lot of people are waiting on interviews. I know dental therapists and hygienists now are about to have their interviews or submit their personal statements. So wherever you are in that kind of journey, wherever you are in that process, whether you've got your offers and you're just waiting now, just make sure you set yourself, smart deadlines, smart measurable goals, and just aspire towards achieving them, and try to stay focused, but not too stressed.
That's it. And okay, how about dental students that have just started, maybe first year or second year or even third year? Are there any tips that you would give that helped you?
Yeah, so I think I've made a ton of mistakes. I feel like there's so many things that if I would have went back, I would have done differently. But it's just all a learning experience. So there's no worry in that. But basically, I would say definitely don't be afraid to ask questions. I think definitely one of the things in first year, you come to first year, dentistry is very new, but all the supervisors, they're using a lot of this dentistry language. They're talking about occlusal convergence and divergence and taper and things like that, and you don't really know what these words mean. And they say, okay, you've got an overhanging margin here, you need to remove this lip of it. You're like, oh my God, I don't know what he means by overhanging. I feel like There were so many times in first year where I was embarrassed to ask. I was like, I can't lie, but I cannot see what you're seeing. I just don't know what you mean, and things like that. So you need to remember they are dentists. Some of them are even, specialist dentists as well. They've got tons and tons of experience. So the dentistry, it comes natural to them. And, there's nothing wrong with saying, sorry, I don't really understand what you mean. So can you just show me just in a bit more detail what you mean? So don't be afraid to ask questions. You are not stupid. Ask those questions. It doesn't matter, because I think the popular saying is the only bad thing is when you don't ask the question and then you walk away not knowing, and then what good is that? So so make sure you ask those questions. Don't be embarrassed and things like that. And I feel like that's something I'm learning now, and I'm able to apply now. So now when I don't understand something, supervisors are so helpful, and they understand that you're learning as well. So they'll get out, do a little diagram on the bit of tissue or the bib and things like that to really show you, okay, look, this is what I mean. And they show you like a little kind of sectioned bit of the tooth and things like that. So don't be afraid to ask questions. Make sure as well you keep a good diary. So the way I like to set out my diary is that you've got your set number of hours of revision that you do every week. So I know in Peninsula they say do about 15 to 20. So put in your lectures, put in your time slots for revision. But then I'd say a good tip is to also put in obviously as well, don't forget to do your time to relax, your days off and things like that. Have a day to rest is important, but then also like emergency slots. So just in case anything comes up, you get a phone call and somebody says, oh, can you do this? Or if there's like a presentation you've forgotten about, and you're not kind of scrambling to find time. You've left yourself some free time that you can allocate to anything that you've forgotten. So yeah, keeping a good diary and just being consistent with it, and just not becoming complacent as well. At any point during dental school, just I know it's difficult because everyone's prone to getting tired and exhausted, but just trying to kind of like when you do lose focus, just recenter yourself and just get focused again. So yeah, and have fun. Don't forget you're in university, you're in your 20s, maybe a bit older. Have fun, enjoy it. You might be in a new city, enjoy the new city, explore the city. For me, I think as well, coming from somewhere that's a lot very, very busy, you might go somewhere far away and just become extremely negative and think, oh no, this is not for me. No, get out there, meet the locals, and you can meet the locals, I don't know, if you're religious, try in a church in that area, or try joining like a new incentive and things like that, whether it's, I don't know, helping support a charity, finding a little part-time job. I think it's important as well to do things other than dentistry. So just find a little something to do outside it. Obviously, if you can handle it, if it's not too much for you, if you've got time for it, just enjoying the city that you're in, trying the different restaurants and things like that. So yeah, having fun as well.
Advice there. A lot of good advice, especially when you're talking about asking for help and asking questions in dental school, because what you find is once people have graduated, people will be paying hundreds and thousands of pounds for courses to go do what they were doing in dental school, to work on phantom heads, to do composites, to work on, even placing rubber dam. People will now be spending thousands of pounds to go on courses as dentists to go refresh on these things. So definitely use the time in dental school to really get good.
Yeah, and it's so funny because actually one of our heads of years in third year, Dr. Andrew Harris, he says that all the time. He says, look, make use of it, because a lot of the supervisors you have, they're all specialists and things like that. After you graduate, as soon as you've got your BDS, if you want to come back and be taught by them, we're talking thousands of pounds. So just squeeze it for all it's worth while you're in dental school. Ask the most questions. Sometimes while I'm revising, I even just write down questions that I know I'm going to go take to clinic tomorrow and just ask them again. So yeah, don't be afraid to just just take the learning experience, all the practicals and things like that seriously, and as well try and understand why you're doing things as well. Don't just like develop the muscle memory. Try and understand why it's actually important to, I don't know, remove the overhanging enamel and things like that. So it's good to know how to do it, but you should know as well why you're doing it. So I feel like that's something I wished I kind of explored more in my years, but I'm now trying to work on it now, making sure I understand the reasons why.
What are you looking forward to? So I know at the moment you're involved with other things like the Q&A with specialists, helping aspiring dentists. What do you look forward to going forward?
So going forward, I do, as much as I love Plymouth and the Southwest, I love home. So I'm looking forward to coming home and returning to my family and, you know, and my friends at home and things like that. But in terms of dentistry, I'm looking forward to, I don't know, it's weird because I think I'm at a stage now. So I'm in 4th year. And I'm at a stage now where I'm like, oh my gosh, like I'm in 4th year. I'm supposed to know things, And they always talk about, when you graduate, you're supposed to be a safe beginner. And I'm like, am I a safe beginner? I'm just like, it's kind of, so I think at the moment, I'm really, really excited to like graduate and, and just do good things, but at the same time it's kind of like, oh my god, I'm kind of scared, like no more supervisor, to call every 5 seconds, like, is this okay like, so it's kind of scary, but I'm looking forward to the experience. I'm looking forward to actually having like my own little single surgery and kind of my dental nurse that I see every day, and it's going to be so fun. And yes, I'm looking forward to the growth. I'm looking forward to the journey, because I know that even though it might be daunting now, it's not always going to be daunting. So I'm looking forward to that day that I can be like, yeah, I'm confident in this. And even though I know dentistry, always learning, but I'm looking forward to knowing more than I do now. So yeah, I'm looking forward to growing really, and just navigating myself through dentistry as a career.
It'd be interesting to know what procedure would you say you look forward to performing, and which one do you not enjoy so much at the moment?
It's really difficult. That's a difficult question. Okay, so I feel like but it's so biased. A lot recently, I've been doing a lot of extractions.
Okay.
So I would say that recently I've really been enjoying extractions. And I mean, I feel like, but before you do like the first one, it's like, oh my gosh, I'm so scared. But then you do it, and it's like, oh my god, that wasn't that bad, So I've really been enjoying extractions, and then, oh my god, it's always so tense, when you're on the TV, you're like, oh my god, please come out, don't break, like please, like everybody's watching, and and then it comes out and it's just like, woo, I did it. but yeah, and I've got so I've been doing a lot of non-surgical extractions, but I've got a surgical extraction coming up. So I've got 2 surgical extractions coming up when I get back in January. So hopefully as well, that's if the patient doesn't change their mind or anything like that. But COVID but but yeah, we plan as much as we can plan. But yeah, so I'm really looking forward to that, and it's scary as well because I never really thought oral surgery would be something that I really, really enjoy, because I am a little bit squeamish. But so yeah, and the one I probably don't enjoy the most, probably perio.
Yeah.
I think everyone would agree that doing a 6-point pocket chart is very, very long. So, and probably definitely perio. But I do enjoy kind of like removing a big, thick bit of calculus and things like that. So when you have patients that have a lot of calculus, that is really fun. And but yeah, it's really hard because I do like a lot of dentistry.
Yeah.
Like, I can't lie, I do like dentistry. I really like ortho as well. So I don't know, it's really difficult. I wouldn't say there's one bit I hate, but there's nothing that I would absolutely not do. Endo is quite daunting as well, but I'm still looking forward to doing it though. So but yeah, so it's difficult.
Perio was definitely one that I didn't. The 6-point perio charting where you're measuring each pocket in the gums, and I remember because we used to work in clinical pairs. So when my partner was now assessing her patient and I was recording the the area
Oh,
from her. I ended up sleeping on the chair.
yeah.
It got so dry, and she was like, Arnold.
And then sometimes you even think they're doing it on purpose. Like,
Yeah.
are you being slow to punish me? Like, oh, and it's like even when your clinical partner's scaling as well, it's
Yeah.
just like, one of the longest things ever. So, what is dentistry to me? Wow. I feel like dentistry is many things. Yeah, dentistry. I mean, I feel like dentistry is an opportunity to serve others. I think that's one of the things I love about dentistry. It really is an avenue to serve others, depending on how you use it. So I think dentistry to me is an opportunity to give back. It's an opportunity to serve. It's an opportunity for me to really fine tune myself and do the best that I can to kind of deliver what they would describe as patient-centered care. So yeah, I think more than anything though, dentistry is an opportunity to serve, as much as it's about me, it's about, the patient, and it's about others as well, supporting others, my friends, my peers in delivering their roles if I'm nursing and things like that. So yeah, dentistry is about serving really. It's yeah.
Perfect. Perfect. I'm going to ask in a moment where people can find you if they want to ask some questions or follow up on something that you said in this video. But guys, make sure to subscribe to the channel. Make sure to follow the Dental Mentor UK Instagram page as well. Find out all about applying to dental school, the dental school experience, and find out what it's like to be air dentist as well. So make sure to subscribe, turn on those notifications. We'll definitely be seeing you at the next one. I want to say a big thank you to Rachel for spending time.
No worries.
Experience. But yes, Rachel, please, where can we find you?
Yeah, so if you type in Rachel Ogun, so RACHEL OGUN in Instagram, you can find me. So you can also find my Facebook as well. I'm very much present on social media. So yeah, so you've got Rachel Ogun Dentistry, which is like my separate kind of dental page, but there's also my personal page. Message me on either. I don't really mind. Any question you have. If I can't answer it, I can probably direct you to someone who can. So yeah, so any questions, just come my way.
We'll definitely be sending people your way then.
All right, no worries. Thank you so much as well, Dr. Arnold. Everything you're doing as well, Dental Mentor UK is very functional. It's very useful, and I'm so glad that not just the people watching it, but even myself to be able to have a platform like this is very special. So thank you so much for everything you're doing.
No, thank you for that. Thank you for that. And in case anybody's wondering, it is December. That's why the Christmas jumper
Christmas
is on.
jumper,
So
yeah.
whatever month you're watching this in, just know for us,
It was Christmas. It's Christmas in a couple of days, actually, about 5 days. So,
That's it. That's it. See
very
you
well
guys
played.
all in the next one.
All right, then. Bye, everyone.
Hoping to apply to dentistry as a graduate, and today I entered the Dental Mentor MMI interview practice. I learned a lot more about the types of interview questions, how to portray myself at interview, and I also got a lot of helpful feedback on things I should change, things I should say and things I shouldn't say. So overall I found this experience very, very helpful.
Really helped my confidence. Up until now I was really worried about the interviews. I didn't think I really knew how to do it and didn't think I'd do particularly well, but after today I have a lot more confidence in myself. I realised that actually I can do it and it is doable.
The workshop today really helped me a lot with the interview prep. They gave really constructive comments and very personalized comments as well, so I really enjoyed it.
If you're thinking about studying dentistry, whether you're in college or whether you're in a degree right now, I think just have a chat with them and they will help you from start to finish.